Major depression affects up to 15% of individuals with cardiovascular disease and up to 20% of people who have received coronary artery bypass graft surgery. Scope Care was founded to assist carers, family, friends, and patients undergoing and recuperating from major heart surgery. It is a specialized organization that focuses solely on the cardiac rehabilitation process, providing healing gardens, online resources, meal plans prepared by medical and healthcare professionals, and counseling and support for patients and their loved ones on a holistic recovery journey. According to research, mental stress has a destructive impact on a person's heart health. Depression, in particular, can raise the chance of an adverse cardiac event, such as a heart attack or blood clots, in those who already have heart disease. Conversely, depression can raise the risk of a heart attack and the development of coronary artery disease in persons who do not have heart disease. How do you feel when you look out the window at a tree or hold a fragrant bouquet in your hands? Do you have a tranquil or joyful feeling? If yes, you may agree that plants can heal. Interacting with plants, both indoors and outdoors, has been shown in studies to be helpful to both physical and mental health. Anyone of any age or skill level may enjoy the benefits of gardens and be in nature. There has been a massive increase in interest in therapeutic gardens in recent years. These gardens have been specifically created to address various applications in healthcare, rehabilitative, and other therapeutic settings. The American Society of Landscape Architects, for example, has a professional practice network of consultants that specialize in building therapeutic gardens. A therapeutic garden is a plant-dominated area purposefully intended to encourage interaction with nature's healing components. Depending on the garden design and the demands of the users, interactions might be passive or active. There are numerous therapeutic garden subtypes, such as healing gardens, enabling gardens, rehabilitation gardens, and refreshing gardens. What is it about a garden that makes it therapeutic? A therapeutic garden's fundamental elements may include broad and gently graded accessible entrances and walks, raised planting beds and containers, and a sensory-oriented plant section centered on color, texture, and aroma. In addition, landscape designers frequently cooperate with horticulture therapists to create beautiful environments that accommodate people of all abilities. While these gardens may be ideal, successful horticultural treatment programs do not require a complex garden plan. Similarly, a professionally designed therapeutic garden that is not accompanied by a horticulture treatment program is unlikely to achieve its full potential. Maintaining a sense of well-being requires interaction with nature. Individuals can receive a variety of psychological benefits from gardening and spending time near plants. Here are a few of the mental health advantages of being around indoor plants and gardens. Enhances mood. Humans are generally happier and more hopeful when plants and nature surround them. Consider a poll conducted at 4 hospitals in the San Francisco Bay Area. According to the survey, 79% of patients felt more peaceful and tranquil after spending time in a garden. 19% felt more cheerful and 25% felt renewed and more potent. Flowers can also elicit good emotions. In a 2005 study, for example, women who received flowers reported higher happiness levels 3 days later. In addition, patients over the age of 65 who receive flowers report enhanced emotions and episodic memory. While you may only need to place a plant on your windowsill at home to create a more relaxing environment, gardening can help you improve positive sensations even more. Gardening reminds us of our connection to nature and helps us focus on the big picture, which might help to relieve depression symptoms. Gardening also releases feel-good hormones in the brain, such as serotonin and dopamine, relieves stress and anxiety. Looking at plants and flowers, whether indoors or outdoors, is a relaxing and stress-free activity. It promotes living in the present moment and stimulates the senses. Cortisol levels fall when you take the time to smell the pleasant perfume of a magnolia tree, for example. Take, for example, a study published in the Journal of Physiological Anthropology. One group of participants in this study worked on computer tasks, while another group transplanted indoor plants. The groups rotated after finishing their responsibilities. According to the researchers, the subjects felt more at ease and calm after the transplanting task than after the computer task. The study concluded that connecting with plants could help people reduce psychological stress. Another study, published in the Journal of Health Psychology, compared the benefits of outdoor gardening to indoor reading. According to the findings, both gardening and reading lower cortisol levels. Gardening, on the other hand, dramatically reduces stress levels. Similarly, following gardening, the study subjects experienced a completely restored, pleasant mood. Increases attention span. Gardening and being in the presence of plants increase attention span, which can help with concentration and learning. Research published in the American Journal of Public Health, for example, investigates the impact of green or natural surroundings on children with attention deficit hyperactivity disorder, or ADHD. Researchers discovered that activities performed in green settings significantly lowered ADHD symptoms when compared to other settings. Spending time in nature can assist a wide range of children. According to the CDC, an estimated 6.1 million children in the United States have been diagnosed with ADHD. Gardening also enhances children's academic performance. The benefit of gardening activities as a part of a science curriculum is demonstrated in research released by the American Society for Horticulture Science. Pupils who gardened outperformed students who studied science in a regular classroom environment on a science achievement test. Improves self-esteem. Adolescents and young adults frequently suffer from low self-esteem. It is common for teenagers to compare themselves to others on social media or to feel compelled to look or act a specific way. Taking digital breaks and being outside can benefit children and young adults. Gardening is one activity that can get people excited about connecting with nature and the world around them. When youngsters care for plants and see them flourish, they witness a transformation. A youngster might obtain a better grasp of their development from child to young adult. Children can also learn that it doesn't matter what they look like or if they have a mental health problem. They can be nurturers and provide their love and care to the environment. Gardening is one approach to develop a sense of self-worth in the face of social pressure. Finally, when it comes time to harvest the excellent produce, any gardener feels proud. Children can appreciate the taste of the veggies they grew, as well as the look of the brilliant flowers from their garden, as well as the boost in confidence that comes with it. Promotes healthy eating. It might be tough to consume the necessary quantity of fruits and vegetables each day, especially if you dislike the flavor of these meals. According to the Centers for Disease Control and Prevention, the CDC, most Americans do not consume enough fruits and vegetables. For example, barely 1 out of every 10 persons consumes the daily recommended amount of fruits and vegetables. Gardening encourages people to include more healthy items into their meals and break free from unhealthy eating patterns. When children and adults eat nutritious foods daily, they will feel better in general. Children and parents can choose the vegetables they want to cultivate and are not concerned about pesticides. Homegrown food tastes better and is more enticing because of the time and effort required to develop and harvest. To name a few, children may quickly grow excellent cherry tomatoes, zucchini, radishes, and tasty herbs. A child is likely to be pleased to eat what they have grown. According to a study from St. Louis University, when families cultivate food, they create a positive food environment. Children who eat homegrown food are more than twice as likely as those who do not rarely eat homegrown produce to get 5 servings of vegetables and fruits each day. Fruits and vegetables are preferred by children who eat homemade food above other foods. Gardening and producing fruit is a simple way for children and adults to receive the necessary nutrients for physical and mental wellness. Scope Care is a secure and healing environment for patients and carers, seeking to make every part relatable and motivating. From new and educational social material to stress-relieving walks through the green spaces. Subscribe to see more videos like this.